Welcome to the Lifestyle Modifications module. This module will provide you with an overview of some key lifestyle modifications for you to recommend to your patients in order to improve overall health and control hypertension. The following objectives will be discussed during this module. Describe a healthy diet with low sodium intake, create an exercise plan, determine healthy weight and BMI goals, discuss moderation of alcohol consumption, and address methods to alleviate stress. According to JNC7 and the American Heart Association guidelines, there are 4 key components to lifestyle modifications: diet, physical activity, weight reduction, and alcohol consumption. You can recommend these along with pharmacologic therapy to all patients with hypertension. Now we will go into more detail on diet and sodium intake. The DASH diet was implemented as a dietary approach to control hypertension. It includes a diet rich in fruits and vegetables, lean meats, whole grains, increased fiber, and low fat and dairy content. It's important to educate your patients about sodium content in their diets. The AHA now recommends that people with hypertension consume no more than 1,500 milligrams of sodium daily. This recent guideline is more restrictive than what has been recommended in the past. Some counseling tips on diet and sodium intake include encouraging your patient to control portion size and to keep a log of daily food and salt intake. It would also be beneficial to help your patient make small changes in their eating habits instead of implementing a strict diet all at once. This will help them stay on track and not get discouraged. A final counseling tip is to discuss with your patient how to read a food label. All U.S. packaged foods and beverages have a food label called Nutrition Facts. Of the many items listed on a food label, there are 3 places that you can easily point out to your patients: the serving size, the servings per package or container, and the sodium content. It is important to show your patient that one serving size does not usually mean the entire package or container, and that a sodium content greater than 20% of the daily value indicates a food high in salt. Also, it is good to remind or educate your patient that sodium is another word for salt. Exercise is another critical component of maintaining a healthy lifestyle and controlling blood pressure. The AHA recommends 30 minutes of moderate intensity aerobic physical activity at least 5 times per week, including muscle strengthening training at least 2 days per week. Talk with your patient about starting an exercise program that they can tolerate, then increasing the intensity and duration each week. For instance, some patients may only be able to tolerate 5 to 10 minute increments per day at first, but their goal would be to gradually work up to 30 minutes of exercise per day. There are other forms of physical activity that you can recommend to your patients along with regular exercise, such as parking further away and taking the stairs. They can also engage in physical activity through household chores and family activities, such as walking in a park or hiking. An additional counseling tip is to emphasize the benefits of regular physical activity, such as decreased stress levels and weight management. Weight management encompasses healthy eating as well as exercise and helps improve overall health by maintaining a healthy BMI. Your patients may be surprised that a weight loss of even 5 to 10 pounds can have a significant effect on lowering blood pressure. Hopefully, this fact will motivate them to make these important lifestyle changes. In addition, it is important to note that a healthy BMI is less than 25 kilograms per meter squared. Please remember to reinforce the 2 essentials to weight management: eating less and moving often. Weight management would be a great topic for a SMART goal. Some helpful tips to provide to your patients are to strategically plan meals. For example, make a specific grocery list before going to the store so that they are prepared to make healthy choices, and don't go to the grocery store hungry. These simple actions can greatly reduce unhealthy food consumption. You should also discourage unhealthy weight loss methods, such as skipping meals, which can lead to binge eating at their next meal. Moderation of alcohol consumption is another important aspect of the recommended lifestyle modifications. It is recommended that men limit their alcohol consumption to no more than 2 drinks per day, and women should have no more than 1 drink per day. You may need to address with your patients what constitutes a standard drink. The standard drink sizes are as follows: 12 ounces of beer, 5 ounces of wine, 3 ounces of fortified wine, and 1.5 ounces of liquor. A high stress level has a harmful effect on blood pressure. Therefore, healthy coping mechanisms are extremely important in managing hypertension. Educate your patients on healthy methods to cope with stress in their life. Some simple ways include keeping a planner to stay organized, giving yourself enough time to complete tasks, and saying no in order to not get overloaded. Other great ways to alleviate stress are through physical activity and talking with someone. Thank you for completing this module. We hope it provided you with helpful information to encourage your patients to implement healthy lifestyle modifications. Please continue on to the next module, Overview of Antihypertensive Medications.